A very good morning, everybody, and welcome back to the AM MedTalk. Another Sunday, and we are back with an interesting conversation once again that we are going to have today. Today, I have with me Dr. Piyush Borkhatariya. He's going to be joining us on this live from Junagadh. So, definitely, I am sure we're going to be discussing a lot of concerns around here. So, this is going to be very exciting. Hello, Dr. Piyush. I see that you have joined in, and I am just sending you a request to join me every Sunday 11 a.m. I have been meeting each of you on the Aesthetic Medicine India Instagram live through our AM Med Talk series. We've completed a month of doing this now, and I have been indulging in conversations with various aesthetic medicine practitioners on yes, Dr. Piyush, I hope you have received my invite. Request you to accept it and join me into the live. So we have been looking at how we can discuss various topics with doctors through these live series that we've been doing. Dr. Piyush, I have sent you the invite again. If you are having trouble joining me in the live, maybe you want to try sending me an invite and I shall accept it. Yes, I have received your invite and I have accepted it. And having said that, like I always mention this, I hope that you all have downloaded the digital edition of the Aesthetic Medicine India magazine, where we have been covering a lot of interesting topics, trending treatments that would be of interest to your practice. Yes, Dr. Piyush, I have received your invite and I have accepted it. At times, it takes a couple of seconds to merge the live. So maybe we just wait on that. And yes, it's interesting times for us because we're seeing a lot happening in the aesthetic medicine industry in India. We see a lot of doctors entering this field now, many more practitioners. And of course, Dr. Piyush was also featured in the recent edition of aesthetic medicine. He made it to the cover as well, like several other doctors. And he did discuss about various aspects, including why it is important to create awareness. Dr. Piyush, I have sent you an invitation again to join in. So, yes, if you want to read his interview, you would have to download your digital edition of the copy. We have the link in our Instagram bio. Also, you could go to our website, which is aestheticmedindia.in, and you would have. Yes, Dr. Piyush, I have received it and I have accepted it as well. It's a tough one with Instagram at times, but definitely we find our way through this. Dr. Piyush, I have invited you again. While I have accepted your invite, I have also invited you again. Yes, and
Yeah.
we made it. Thank you so much. Good morning, Dr. Piyush. Thank you for joining us.
Yeah. Good morning. How are you?
I'm doing very well. How are you doing, Doctor?
Fine, fine.
I think this is very normal with Instagram where we try to do these lives and it takes a few seconds by the time we are able to, merge the call and club in. But glad you've been able to make the time and join us. For everybody joining us into this live, I would once again like to mention that Dr. Piyush Borkhatariya, he's a chief dermatologist and the founder and director of Est Wellness in Junagadh. And he's joining us live from Junagadh. Of course, he's had a very, very busy week, and I'm glad he's been able to make this time for us today. Again, he and I are on a curfew time, I could say, because he needs to get back to his practice and the day, and I will go very fast with this. So, Dr. Piyush, today we are going to be discussing hair concerns. Of course, I know you have your expertise in various skin related concerns, hair related concerns, but today we will focus only on hair. And of course, if time permits, we will take questions that come into the comments as well. For everybody watching this live, I'm Shriyal Sethumadhavan, the editor of Aesthetic Medicine India, and I'm delighted to have today's MedTalk, AM MedTalk series with Dr. Piyush. So, Dr. Piyush, straight getting into my questions, can you start by explaining, the most common causes of hair loss that you encounter in your practice?
Yeah. See, nowadays what happens to like I have seen like many young people are facing hair loss issue. Very young people like 18 years old or 20 years old have a male pattern baldness. Females have a big proportion of the hair loss. So the main reason is the hormonal cause, right?
Hmm.
Mostly in the males, they have androgenetic alopecia. That is due to that they have a bald patch over here. They have a like thinning of the hair. The second most common problem that is the nutritional one, right? People have a nutritional deficiency mostly due to iron, B12, multivitamins, and due to that they experience the hair loss. Also, they have a rough hair, they have a textural issues, and the third most common reason is telogen effluvium, which was like people don't know that they have telogen effluvium. Telogen effluvium is what? Then whenever you have like some problem in your body, like you have some disease or illness, whether you have done dieting or you are in a stress or you have gone through the surgery or anything, you are, have pregnancy or you are in some hormonal disturbance, then you have excessive hair fall after 2 to 3 months of that episode. Right? That is called telogen effluvium. Telogen
Hmm.
effluvium is very common, and most of the people they don't know that they have a telogen effluvium. That's why they have a very less density. So in recent scenario, you must like we must accept that there are so many people they are experiencing the hair fall and hair loss also. There is a vast difference between the hair fall and the hair loss. Hair fall is the hair shedding only, and hair loss, or you can say baldness, is a different issue, right? Due to hair fall, you may have a hair loss, but you may not have the hair loss. Okay, so if you are experiencing only hair loss and only hair fall, you don't have any bald patch or you don't have any like decrease in your density, then you don't have to worry about it. But it's on a rising phase. People are mostly out of 10, like I can say almost 5 or 6 people are experiencing the hair fall, and that
Right.
is due to our lifestyle and the nutritional part also.
Right. So I know you touched upon this while you just spoke, but if you can clarify it a little more for people watching this live, that how is the hair loss pattern different in males vis-a-vis the females? So how are both the hair loss patterns different?
Yeah. See, if you are talking about like hormonal thing, that differentiate the male and female. The nutritional one and the telogen effluvium both are like the pattern are same. Like in telogen, you have excessive hair fall, okay, and in nutritional you have a textural issue. You have increase in the shedding phase. That's okay. But in female pattern baldness and the male pattern baldness, you have a different patterns. Now I can show you on one paper also, if I can able to. This is
Yes.
actually a male pattern baldness. Okay, you will have a clear pattern like frontal recession. Then you have a it goes to the occipital region. The occipital area, the posterior area will remain same. Okay, and in female pattern baldness, you can see there will be a frontal parting and you have a central elevation. It's centrifugal pattern. Okay, it's going on in a similar fashion like this. Okay, so in male and female, both have a like pathology is same in the androgenetic alopecia. That is the thinning of the hair. That people should understand. Mostly people don't know that they have a thinning of the hair. Like they are complaining that doctor, I have a like I'm experiencing the more hair fall now, and have a decrease in
Hmm.
density. Due to hair fall, they don't have the alopecia. With each cycle, the hair is becoming thinner and thinner and thinner, and due to that they have a decrease in the density, and after some time they have a very less hair. We have almost 50% hair extra given to us, right?
Right.
So if you have almost 15% hair over the scalp, then you like your scalp will not be visible. But after 50% of the hair loss, if you have a 40% of the hair left, then your scalp is visible. That we call the alopecia, or we can contribute to the baldness, right?
Right.
So in male
Right.
and female, but the ratio of male pattern baldness is more than the female pattern baldness, right? You can say out of 100 people, 10 to 20% are the female, 80 to 90% persons have the male persons, and they have like, in nowadays I have seen like male patients, they are experiencing baldness and the hair loss early in their age group, like in
Hmm.
teenage or in the 20s, in the 30s. Previously, before 10 years, it was like after 35 years or 45 years or the 40 years. That has dramatically decreased 10 years younger. Like 18 years old have a like bald patch over the frontal area. 22 years old have a like full scalp bald. Right, so there are increasing number of patients of the male pattern baldness. Yeah.
Right, right. And what are the key diagnostic tools or techniques you use to determine the underlying cause of, hair loss in your patients?
See, there are almost four types of the hair losses. Like one thing which we have didn't discuss is alopecia areata. In alopecia areata, you will have a like round patch. Okay, round is patch over the particular area. Like you have a one a bigger 1 centimeter to 2 centimeter bald patch area. That is called alopecia areata, or you can say undri also, right?
Hmm.
That is the that is the specific region is gone. So one is the nutritional one, that is called diffuse hair loss. The second is the telogen effluvium, that is due to the cycle defect, and the third is the male pattern or the female pattern baldness, that is due to the hormone. And the fourth one is the alopecia areata. Alopecia areata is one type of the disease. So for this alopecia areata, we need, like we can examine it clinically and with the trichoscopy, like we have a scope like this. Okay, so with the scope we see that whether this is the like a patch having the exclamation marks or the cut hairs or the bald patch, then we can come to the diagnosis. In female pattern baldness and the male pattern baldness also, we are doing the same. Okay, with the trichoscopy, if we see, and if we see the hair thinning out very well, then we can confirm that this is the androgenic alopecia. In telogen effluvium, we need to do hair pull test, like we are pulling the strands of hair like this. If we have a like in 10 strokes, if we have a more than 5 times we have hair in our hand, then it is positive for the telogen effluvium. And the diffuse hair loss, you need to examine it clinically and also laboratorically. So clinically, if you
Hmm.
find rough hair texture is damaged, or the flex, and you have two different colors of the hair, or brittle ends, split ends, then there are chances of nutritional deficiency. And we will like do the blood test also. We are checking hemoglobin, B12, vitamin D, and the ferritin level, and the thyroid. These are the most important tests we are doing in our OPD. So the diagnosis is almost 90% is clinical, and
Right,
with the
right,
trichologist, 10% we need blood reports. Otherwise, any good trichologist, like qualified IDL specialist or the MD skin specialist, they will diagnose you with the trichoscopy and the clinical examinations.
right, right. What about the trending procedures? What is it that is trending in terms of, the treatment options for these hair loss concerns?
Yeah. So nowadays, what happens to the like the people? The people are like they are taking medicines and so many things. They are applying so many things, but right, they are more concerned that something should be done, and they want a faster results. So the trending treatments are the procedures, like which we are offering at our clinic. But dermatologists, we are offering so many therapies. We call it hair therapies, right? That comes the like PRP, growth factor. You will have a stem cell treatment. You have a mesotherapy.
Doctor,
You have a light
your
therapy.
voice
You have,
is breaking a bit. Your screen has got a little blur.
yeah. I'm saying the same thing due to the, I think, network issue.
Yes, yes, yes.
Okay,
Okay, it's
can
clear
I,
now. The screen is
yeah,
clear now. Yes, we can hear you.
okay. I will repeat it again. There are so many procedures which is trending right now, because patient wants a faster results. So
Hmm.
these are the things which give you a faster result, very good result, and previously unachievable result. Like previously, what happens to the people are taking medication and applying lotions, and they are frustrated with that thing. There are limited things which they can take. So
Hmm.
right now there are so many treatment like PRP, GFC. We have a stem cell therapy. We have a mesotherapy. We have a like dutasteroid therapy. We have a growth factor therapy, peptides, mesotherapy, nutrient fusion, light therapy. There are almost 12 types of such therapies are available, which is trending also and which is very, you can say, effective also.
Hmm.
The most right trending thing right now is the therapy part. So any person who is experiencing the hair fall or the hair loss, and they have like tried so many things, or they have like purchased online things or so many things, and they are not getting results, then this is the perfect thing they should do. But they need to take multiple sessions, like 6 to 12 sessions are required to have like effects. Okay.
Hmm. Hmm. We see PRP has been, it has gained a lot of popularity in hair restoration. But in the current times, how does it compare to other treatments? And are there any other new treatment options now that you're applying?
Yeah. See, PRP is what? It is platelet-rich plasma. That is from your blood. Uh, we are extracting the platelets, blood growth factors, your serum and everything, and we are injecting, or we are penetrating with the microneedle or the derma roller, right? And that will give you the good result. The next version of the PRP, that is the GFC. The same way, like growth factor concentrate, that is called. Okay, they have more
Hmm.
growth factor concentration than the PRP. So this is also one of the option. If you are like, if you have taken PRP and you want to try something different, then you should go for the GFC. GFC is also working very well. Yes, PRP is also still working. It's not like that it's not working. But what we are doing, we are combining the treatments. Like for the one
Hmm.
session, we are giving PRP. On the second, we are giving GFC. On the third, we are giving stem cell. On the fourth, we are giving peptides. On the sixth, we are giving again PRP with the growth factors. There are so many different combinations we are giving, but they at least need 6 to 12 sessions.
Hmm.
Apart from PRP, there are so many different options which is available also, and people are trying also. And you must try the different combinations, right? That will give you a good response.
Right. So I was just coming to the combination treatments actually, that how effective have these been in your practice, and how do you determine when you want to go in for a combination treatment, and what could the right combination be?
Yeah. So, like all over, like we see hair treatment as a holistic treatment plan. Okay. So for the combination particularly, so we need three things. The first thing is the medication, like the oral medication,
Hmm.
on topical medications. These are the two ingredients of the first, like that is the treatment part. So any
Hmm.
patient having a nutritional deficiency, they need to take like iron, B12, vitamin D, and multivitamin with the biotin. These are the most common ingredient for the diffuse hair loss. In telogen effluent, they need to take multivitamins along with the, if any deficiency is there, then we are supplementing the B12 or the iron part. In
Hmm.
androgenic alopecia, along with the oral medication and the vitamins, we are adding like finasteride or the dutasteride. That will prevent the further progression. In the topical, we have like two options, so minoxidil and the peptides. So we are
Hmm.
applying minoxidil over that area, and there are so many peptides like capexil, propapil. There are so many peptides available that is equally effective. And the second part is the procedural part, which we have discussed, like that is PRP,
Hmm.
GFC, mesotherapy, stem cell, and the third part is the home care. See, the home care is most important, and remind me in the last what should be the like ideal lifestyle each people have should have, that will prevent the further progression also, and that will increase the result also. So lifestyle matters a lot, so they need to like focus on their lifestyle. Their routine should be consistent. They should apply the lotions and the shampoos regularly. Their diet, their oral wellness activity, that is also determined. So these are the three things: medication, therapy, and care part. And in also therapeutical part, we are combining, like we are combining electroporation with light therapy. That is the low level
Hmm.
diode laser light therapy along with the mesotherapy or PRP. So combination always works and gives the very good results.
Right. I think one of the challenges for you could always be managing your patient expectations,
Yeah.
especially in the case of hair, because the results take its time. It's not something that you would see in a couple of days or overnight. So, how do you balance, the whole process of managing your patient expectation and the desired, and vis-a-vis the desired outcome that your treatment is going to result into?
So the most important thing is the consultation. Like I have one boy came before 2 days. He complained, well, I have like tried one of the online brand that is starts from the T. I don't want to take the brand name. So he had tried like they are giving Ayurvedic thing and the minoxidil only. So he had
Mm.
stopped everything and he had tried like for 6 to 8 months. Then after that he was frustrated and he came to me, and he told me that before like 8 months I was about to like come to your clinic, right? And then I have seen this advertisement on the Instagram, and I have started doing this thing, and I have wasted almost 7 months, and my alopecia is also progressed. So on the first consultation, what we are doing analysis, like what are the
Mm.
grade, what is the exact diagnosis you have. That is like that cannot be done by the online survey only, right? So you need to
Mm.
understand, you need in-person physical appointments, right?
Right.
And you need to see a perfect qualified MD skin specialist to have a perfect diagnosis first. If your diagnosis is done, then your 50% work is done. And then the
Mm.
second thing, what you need is the therapist. Only medication will give you almost 30 to 40% hair back, and your progression will be arrested. Your full hair, or like if you have a baldness over there, or you have a like severe hair fall, this will not work. So you need some therapies also, like PRP, GFC. There are so many things you need it, and we are delivering it at the clinic. And for that, you need to visit multiple times, for 6 to 8 times, or any if you have a very big patch, then you need 10 to 12 sessions also. So in
Mm.
first session we are like explaining everything, that due to this you have a hair loss, and for next couple of months, like for the 6 months or the 8 months, you have this path to do. And trust me, whatever we are explaining, they are following it. And almost 90 to 95% of the people who are following, almost we have a 5 to 8% of the dropouts because of so
Right.
many reasons they could not able to come back, and they have the perfect regrowth back. The key is the consistency, and the key is the proper consultation and the proper diagnosis from the qualified dermatologist. And the second thing is the procedural thing. If you do it properly, then definitely you will have a, like I can show in my we can extend up to 5 minutes, no problem.
Sure.
We have time.
Great. I am
I can show you
always
one.
happy to do that.
Okay, no problem. I can show you like this. You can see, right?
Yes.
This young
Yes.
boy having a problem with the hair, like he's having growth like this within
Ah.
almost 12 months. This is also same, right? These are all our patients, right? So this type of result you will not get with the medication only. You need some therapeutic part also, and with the online thing or the do it now therapy, you will not get it. Like, so you will have a result like this if you can do proper procedural thing, proper diagnosis, and follow it regularly.
How many months it takes for this kind of result? Like some I saw they were almost like I could see the baldness so visibly, and now I cannot see it at all in the post. But what would have the average period been to achieve
Uh,
that kind of a result?
8 to 12 months. See, our
Okay.
hair cycle time is almost 7 to 8 months, okay?
Hmm.
Average hair cycle time. So 8 to 12 months it requires. So that's the most important thing. You need to consult the doctor. Your diagnosis should be perfect. Your treatment plan, there is the plan, okay? You have to follow it, and you have to check the regularly about the monitoring, and about the like how is your effect, is there any changes needed, and after 8 to 12 months you will have a very good results. So this is the thing, which people are don't know. Like they are trying so many
Right.
things, and they're like they are trying different things. That is okay, but due to that, their progression is happening. Okay, and they have a like
Right.
more grade of alopecia. Like they are in the grade 2, and after 1 year they are in the grade 4. So we need to grow their hair back. Okay, so any hair
Right.
loss or anything you have, then you need to like consult a skin specialist, and arrive to the diagnosis and follow the treatment plan. Yeah.
How important does post procedural care become here? Because a lot of times, patients feel that we've gone to the doctor, they've done a procedure, now that is it. And though you may give them a post procedural care, they may not put that kind of a dedication or commitment to it, which could impact a result. So, how important does post procedural care become over here?
Post-procedural care is integral part of the treatment. Like they have to like apply, they have to take medication, they have to apply topicals. So not much care they require at home. The only thing they need to take is taking the oral medication, which is prescribed, like vitamins and everything. The second thing they have to apply like minoxidil or the peptide, which is given to their hair, and they need to do the hair wash. Like for the male, we are recommending daily hair wash, and for the female, we are recommending alternate hair wash.
Hmm.
That's why the absorption of the topicals and will not be hampered. Okay, otherwise they have to focus on their routine, on their diet, on their lifestyle, activity. That's it. The main part is the procedure that we are doing it, because it's gone inside and it started doing its part. Okay,
Right.
so in the hair part, particularly for the hair procedure, they don't need much post procedural care.
And we see like several other treatments when it comes to aesthetic dermatology. Even hair loss is surrounded by certain myths and misconceptions. So, if you can just touch upon some of these common myths that you have encountered with your patients,
Yeah.
which have probably taken you by surprise.
Yeah, yeah. So I have seen that people are mostly thinking that due to dandruff they have a hair loss. Like, but dandruff is not the main problem for the hair loss. That is the
Mm.
first thing. They are thinking that due to hair like dandruff they are experiencing hair fall. Main concern is the dandruff technology is in the scalp, and the hair is
Doctor,
down
your
the
video
cheek.
has again got a little blurry.
Okay, now it's okay.
Yes, your voice is clear now. Yeah, the video is getting clear. Yes, I can see that. Yeah, you can continue.
So the due to dandruff is on the scalp, and your hair follicles are inside. So due to dandruff, you don't have any hair fall. So that is the common misconception. The second myth which people have is common is that due to constipation they have the hair fall. Like if constipation is cleared, then their hair fall will be stopped. That is also not the truth. Like overall health is definitely affecting your
Yes.
hair cycle and everything. But like if you have a constipation, you are taking any liquid or anything for the constipation, and if your constipation is relieved, then your hair will not grow back or your hair fall will not stop. Overall health or overall your like lifestyle will definitely determine that how your gut is responding, your body is responding to your hair cycle.
Yes.
The third myth which we have seen that any remedy, like people are asking that please doctor prescribe me one shampoo that will stop my hair fall. That is the biggest myth I have seen in my practice. See, shampoo is for the cleaning of the hair. That is no relation with the hair fall or the hair loss. So you are like applying any shampoo that determines your quality, that determines your like overall texture, your brittleness or the dry or rough or anything quality part. Okay, not the hair
Hmm.
fall part. Okay, like people are applying onion shampoo and everything, and they are saying that like due to onion shampoo their hair fall stop. Hair fall will not be controlled by any shampoo. That is the number three thing. The number four myth which we encountered, that people are saying that okay doctor, I have taken this medication and I am applying this, my hair fall should be stopped. That cannot be happened immediately. Your hair fall will be controlled within 3 to 6 months, and it will be controlled, right? So if you are like experiencing 200 hair per day, then it will become gradually down, 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 down to the like almost 10, 20 to 30 hairs per day. But
Hmm.
like don't expect that you will have a zero hair fall, right? That is also possible, but few days after few days you will have some shedding also, because our hair are not static, it's dynamic. It's
Right.
continuously getting back and going and coming, going and coming. So you are like you will experiencing the normal hair loss, like the normal physiological hair fall, which says that almost 30 to 100 hair fall per day is normal thing. See, and
Hmm.
people are like coming to us with like they have a 10 to 20 hairs loss per day, and they are coming to us that, oh doctor, I have a severe hair fall. So don't
Right.
like panic if you have a, like 10 to 20 hairs loss per day. That is also okay, but you have more hair loss, then you have need to cross check with the doctor. And don't expect that anything you start and your hair fall will become stop. It will gradually decrease. Okay.
Right, right, right. Okay, doctor, thank you so much. I think we've had some great insights on hair loss and hair fall, and of course, a lot of treatments that you've also mentioned. Thank you so much for your time. And what we would do is, since we would have to end this live right now, if we have any questions coming in, the live is going to be available on the Aesthetic Medicine India Instagram page, as well as it would be available on Dr. Piyush's Instagram page. So, any questions, you could leave it on the comments, and we would be happy to answer it in the days or the times to
Yeah,
come. But having said that, once again, Dr. Piyush, thank you so much. And I would look forward to interacting you much more through our lives, through our magazines, and our conferences that we do in the year. Thank you.
definitely. Thank you so much. Thank you.
Thank you. Have a good day. Bye. Bye.
Bye.